and welcome to
Bear Care Corner.
Bear Care Corner. From the heart of it all, here in the meds room.
A lot happens in here.
Yes.
A lot happens.
We're going to be doing a little med room tour, and Nicole has some equipment she was very excited to show you. So stay tuned. Let us know where you are tuning in from. Let us know if you can hear us. Hi, Gail.
Hello,
Thanks for
Gail.
confirming that we are actually live.
Yeah, we were like, come on, Gail, let us know. We depend on you so much, honestly.
We do. Otherwise, we just talking to ourselves.
Yeah, Deb is here from Minnesota.
Hi,
Hello.
Deb. Welcome. I'm Andrea, the animal care manager.
My name is Nicole, senior animal caregiver.
We're here in the med room where all the magic happens. There's a few different kind of medical related stations, and this is the real hub of our main equipment, our medications. We have an on-site pharmacy. This is the whole room. Like if there's the walls beside the goal.
Yeah.
We're looking to expand with the new property, so we have some ideas, but this is kind of the hub. So we are going to be showing you around a little bit, showing you a few knickknacks, showing you a new equipment that we got that we're very excited about. If you have any questions during the program, let us know. We're going to answer them live if we can catch them. Sound is good. Thank you for confirming.
Yeah, thank
Sometimes
you. Technical
difficulties do happen. All right, well, we are live. Let's get started. Let's get that tooth out here while people are starting to tune in.
Yeah, I would say that's number one top priority.
Yeah, Nicole has a surprise for you, but this is also a bit of a surprise. So what is happening here?
In this mystery container?
Yeah, mystery container number one. We have a few surprises for you.
So this one actually has two really neat relics in it. They're both pig teeth.
Yeah, show the top. There's our molars.
Yeah, so we've got
both molars, right?
A molar there. I think, with the container down,
Hi, Sylvia. We're looking at teeth to start with. Why not?
Oh my gosh, this is so confusing. I think that this small one is a premolar.
Yeah,
like
it's a different shape.
That's a little guy.
And the roots on that aren't super nice.
Yeah, but this is a huge one. So finding teeth just out in the world, not really a common occurrence.
Pretty rare.
Yeah, we get excited when it happens just because we like those sorts of artifacts, and it's good for us to know like someone is losing teeth. But I actually found both of these. Found this one is probably Tuesday last week, and then the molar on Wednesday. Literally
never
the
happens.
next day. I think over there, like behind
both
the
in
camera.
Malcolm's herd?
Yes, both in Malcolm's herd. One was found in the feed area, and I honestly thought it was like a piece of shavings or something, but I don't know. It's always a thing. I always think I'm finding teeth. Like it's so rare to find them.
I'm always looking at the ground. You just never know.
I'm always thinking like, oh my gosh, is that like a tusk or something? I'm always thinking that I'm finding teeth, but this time it was actually teeth twice. So we have our little molar again. It's
pretty bad roots.
Yeah. So the roots, I mean, I wonder how big they would have been, but yeah, they're quite small. They're quite like, it's so hard to show, but yeah, they're quite like degraded. Like there's definitely like they've been kind of falling apart there. The big molar definitely has big, stronger roots, but they're still a little bit kind of mangled there as well. So one was found in the feed area, and then one was actually found right around the pig lift. So we're not sure.
And those, like the feed area kind of makes sense if they're eating. The pig lift, there would be no reason their teeth are falling out.
Unless it was loose to begin with, and then they just spit it out, or it just happened to come out
the
at that
excitement
moment.
of getting into the lift. So that ties in with an appointment we have tomorrow with Raymond. I feel like we're on the bottom, but maybe that's fine. So Ray's going to the dentist tomorrow.
Yes, tomorrow is I guess tomorrow is his pre-dentist appointment, then his dentist appointment is the following day.
He's going in for the afternoon. That way they can control his fasting period. So when they're doing a sedation, they want him fasted first. He's not super great under sedation, so they're being extra cautious with him. And then on the 24th is a sedation with dental exam, probably rads, because he has a history of pretty stinky breath. And he's been dropping his hay recently. When hay takes a lot of work, like you see any animal that relies on eating grass and hay as their primary diet, the type of teeth they have, it's kind of similar vibe with ruminants, how they have to grind it down.
Really big surface area there for grinding things down.
So he's eating his regular food fine, like the pellets are pretty easy to break down, especially when we've pre-moistened them, which is on some of the meals. But with the hay, sometimes he's eating hay and just kind of lets it drop out of his mouth. So is there dental pain? What's going going on there. We're going to be doing some exploratory, or OVC is.
Yes, in a very controlled environment.
Yes,
So, yes.
On Thursday. So he's going in tomorrow. He's going to be absolutely amazing.
He's going to be perfect.
He's the type of person that's just like, oh, cool, we're going for a car ride. We're going, we're going in the trailer. So he's going to be very good.
Yeah, he's excited for his field trip. I'm sure he's going to be a delight at the hospital. So
some pigs have been extremely hard to get in the trailer. Like, I think the top of my head always was Dan.
Yeah, definitely. I remember a couple times Brindle being extremely difficult to load. Like one or two times, I don't remember if it was his urinary issues or one of the hoof abscess. I don't remember. I remember one time it took a long time and so many of us to load. But I feel like the last time he went to OVC, maybe he loaded well. I don't know. It all kind of gets jumbled up in my brain.
Yeah, I'm just thinking Dan particularly. And sometimes it can just be one incident and not anything even dramatic, but they can get it in their head. They're like, oh, I'm freaked out by this.
For sure.
I remember we brought him back at one point because Dan was back and forth from OVC a few times with medical issues, a variety of them, and he came home and was spooked and went into a stall. And then remember when he wouldn't leave that stall, he wouldn't like cross the line out of the stall because I don't know if he thought he was going to get loaded again.
Right.
Raymond, complete opposite. I mean, that we've experienced so far. Sometimes something can happen, not even that dramatic, and they can get it in their head, and that changes things. But the last time I loaded him, he wasn't doing well. It was during a
like
breathing
overnight,
episode. It was at midnight, literally 12:30 a.m. We were loading him, and he's just like couldn't breathe very well. That's all sorted out.
Right.
But he's just like, cool, I'll just come on this trailer with a Fig Newton.
Why not?
What are you guys up to? I want to be involved. So
bless his heart.
I think he's gonna do really well. But that's
Yeah,
Raymond's
I
update.
agree.
Teeth, we're not sure whose they are, but maybe if they shoot rides, we're probably going to send those with them.
Yeah, that'll be kind of neat to see what we have here and see if that kind of corresponds to what he's going on. So, I mean, it could just be someone else like coincidentally losing their teeth as well.
Could happen.
We have an aging population.
Might not necessarily even be an issue for them.
Yeah, exactly. So it was just very interesting that all of these dental things kind of happened at once. Well, finding 2 teeth in 2 days is
like maybe once a year.
Yeah, like if that, it's wild.
Not even. Yeah, we haven't found teeth in a minute, and I think the last one was maybe goat or sheep.
Yeah.
I remember finding those ones, or somebody finding those ones.
Yeah, we have another pig molar back there, but
yeah, we have a cabinet of curiosities where there's a variety of bones and different things that we've discovered or found or whatnot. So it seems like a lot of folks are tuned in now. Do we want to get into the main event?
Yeah, whoa, the main event.
Unboxing.
Yeah, very exciting, very nerdy stuff.
Never a problem.
Yeah, absolutely.
He's an angel.
He really is.
He's the best. He does this little cute thing with his hand where he puts his hand up.
They're going to love it. Yeah.
Dr. Alejandro is going to be very excited
to
have him as a special guest there for a few days.
All right. The main event. So,
are we in a good spot with the camera, or do we need to turn it? Or Nicole's going to hold everything up?
Yeah, I think I'll just like awkwardly hold the box and then kind of just do it like YouTube style.
Yeah.
Here, I guess. I don't know. We'll see how it goes.
We're influencers.
Yeah.
So what is the background before we get into the box? Like, this is very exciting.
It's very exciting.
At least for us.
Yes. So this kind of...
for Nicole.
Yeah. So this corner behind us, this is our little lab, our on-site lab that we have set up. So right now...
the microscope.
Yeah, so we have our microscope, our centrifuge, some blood work collection supplies, fecal running supplies as well. So we've been doing on-site fecals now for, I feel like it's been forever.
Yeah,
like
at least 4 years when we learned it, and I learned how to do it, and then you learned how to do it, and a few other caregivers know.
Yeah, so we've been doing the fecals on site for a while. So one of our goals has always been to kind of be able to do as much stuff on site as possible, just to make us a little bit more self-reliant, save some time, save some money as well. So being able to do some more lab work on site is very exciting.
It's been the goal. We've been getting there slowly.
Exactly.
It's very exciting.
Yes. So I guess it was not last holiday magic, but the one before that was one of the big things, was fundraising for some of these supplies. And then, in case you haven't heard, we moved. So that was pretty chaotic. So all of this has led us to this wonderful box. So let's just get started.
I don't
guess.
know what half of the stuff is. Nicole's a vet tech. Nicole's the expert on this aspect of things. So Nicole's going to do most of the speaking, and I'm just going to be going, wow. Like, what is this?
So first thing, and I won't go like super intense, but I mean,
You could.
yeah, well, you know what? We'll just get
Gail's
into it.
ready.
Yeah, absolutely. So the first thing. Wow.
That box.
So this is called a refractometer, and they're used in veterinary medicine, but also random other things like people who brew their own beer use these for
Yeah,
stuff.
I've seen it in farming, people testing like how much sugar's in their tomato or something.
Yeah, things like that. So basically, I mean, I don't understand exactly how it works, but it has a little prism in here that you put a sample on, and then you look through here.
What kind of samples are you putting on there?
Excellent question. So you can do either urine, just straight up urine on this little prism. So basically, I don't think that I could get it to like for everyone at home, but basically when you look in here, there's actually
Put it up to there.
Pardon?
Put it up to there.
Maybe oh my gosh, maybe it will work.
Well,
Oh my gosh.
it's reflecting everything.
Oh, okay. See that blue thing?
Oh, wow.
Oh
Yeah,
my gosh,
yeah.
it's kind of there. So when you look through here, there's actually a couple different scales. So one is for urine and one is for plasma, so a portion of blood.
Ooh.
So basically when you put a drop of urine on here, something to do with light and science, when you look through, it tells you what the specific gravity of that urine is. So basically how concentrated or how dilute that urine is. So that's really helpful if you're looking to assess things like organ function, is presence of a UTI, that sort of thing.
Have we used that yet?
Not yet.
Not yet. Just came in.
Yes.
Fresh out the box.
Not yet, but soon. I mean,
Nicole's going to be running around using that every day now.
Just like collecting urine samples. Why not? Because it's good to get a baseline as well, right? To
True.
know.
Even if something's not wrong, we're not suspecting anything.
Yeah.
That'd be true. Could we do it with like the cats? Like somebody who has a history.
Yeah.
Enrique has history of UTIs, and so
Yeah.
has Claudia. They've had some issues.
Yep. Yeah, so definitely we can be getting some baselines. So the other thing that it does is it measures total protein in blood. So that's another thing we can be doing on site. So the total protein in the blood can kind of be an indicator of like proteins in the blood, so like antibody function, presence of excessive amounts of parasites. So that can be extremely helpful when we're doing fecal testing to kind of use to kind of use these different diagnostic tools in addition to the fecal testing results to kind of let us know, okay, there's a relatively high fecal count, but then we're also seeing increased or decreased protein in the blood. Protein is also pretty significant with like Iones cases, for example, because one of the first kind of clinical, sorry, we're kind of getting into it now. One of the first kind of like clinical signs that you might see in Iones disease, which unfortunately we have lost Gloria, one of our goats, to Iones disease earlier this year. One of the first clinical signs could be low serum protein. So basically they're losing protein from their blood and it's going into other parts of the body that it shouldn't be.
Actively affected by the disease, because they can have it for years.
Exactly, when
so
they're
you only
actively
see
affected,
it.
yes.
Okay.
Yes.
It's one of those diseases where they can have for years, but not necessarily be showing clinical signs, so that might be indicating. Ooh.
Yeah. So that's our refractometer.
Amazing. That's one of the many things in Nicole's magical box. I'm going to go to the comments for this. A few questions while Nicole gets the next thing ready.
Yeah.
Have you noticed a difference when they eat? I'm assuming this has to do with the teeth we were looking at earlier. Just with Ray, I haven't seen anyone. Look, at mealtime is a big time for us to monitor the pigs.
Definitely.
Are they coming out to eat? If a pig doesn't come out to eat, that's like pretty much a medical emergency.
Always, yeah.
The hierarchy, like, are they getting chased away from meals? We've added a lot of extra bowls to each group, so there's a lot of variety and a lot of space for them to eat. You know, like there's like probably at least 5 extra bowls in our pigs. Only Ray with his dropping hay.
Yeah, we haven't really seen any differences with anyone else, so
not yet.
Yes,
and this could be you just
could
lose.
Change.
You just we'll keep an eye. we'll see what Ray's mouth looks like.
Yeah.
We do know that Phoenix, his brother, had pretty bad teeth, so this might be related. Hi from Portugal. Hi, Gil. That's so
hello.
cool.
Welcome.
Wow.
Very
Welcome to the
cool.
program. This is where we're chatting about the nerdiest
Yes.
animal care stuff. This might be one of the nerdiest episodes
Yeah,
we
it's
have
quite
in
exciting.
recent times. We kind of try to mix it up, but we get really excited about this kind of stuff, and this is the kind of stuff that we're aiming toward all the time here at the sanctuary, being as self-sufficient, like Nicole mentioned, doing our own stuff and being able to get those results pretty much right away.
Exactly.
Instead of waiting for the vet to come out, waiting for lab results. We're always observing. We become little detectives, looking at the residents' changes, and then Nicole can pop in here with some blood work or urine or fecal testing or whatever needs to happen. Would it detect diabetes? Is that refractometer?
So no, but the next thing, well, I mean, the next thing I'm holding won't necessarily diagnose diabetes, but it can be part of a diabetes diagnosis with assessing urine.
Do they get diabetes?
I am not familiar
I've heard of
with
cats.
Yes,
we have cats, but I
yes.
can't think of any of the other residents.
Yeah,
I think of thyroid with some of the chickens.
yeah.
I'm not sure. Pigs are very similar to us, but I've never even considered or
to
heard
be
of
honest,
cases of diabetes
Me
in
neither,
pigs.
but that's honestly a really great question because I don't know, but that's a great question.
For a variety of reasons, and not specifically for diabetes, we don't give them high fat or high sugar. We don't make sure they're not eating a lot of fruit and different things that can trigger, especially in them with hooves. Hoof
the
issues.
connection.
Like you wouldn't think of eating a bunch of bananas and then getting hoof issues, but it creates inflammation that can quickly lead to hoof issues. So that's a whole other thing.
Yeah. That could be next
Gail
week.
says Nicole's going to be chasing people around the farm trying to test them.
Yeah, honestly, a
Look
thousand
Look
percent.
at the glimmer in her eyes. Definitely
Yeah.
ready. Definitely ready.
Yeah,
now that we have all these
called
supplies, thanks to your donations,
Yes.
we're able to get all of this stuff. And Nicole's going to keep you posted, doing lots of videos of her running around,
Collecting.
gathering.
Yeah. It's very
We did
exciting.
blood work a few weeks ago, but that's something that we sent in. So
Yes.
what's next in the box?
Urine dipsticks. Whoa. So these can be used for all of the residents, basically. So urine, also a very, very great diagnostic tool. So the urine dipsticks basically have a whole bunch of different things that they look for. So like glucose in the urine, protein, the presence of white and red blood cells. I think I said pH already. Glucose. So again, urine dipsticks mixed in with, you're going to get involved with that too.
I don't know what any of this means, though. I've done water testing recently, and this is not the same thing.
Yeah.
It's a dipstick, but I don't know.
Yeah. So again,
I see glucose.
Yeah,
I see pH.
Yeah, very, very exciting. So this again could be really good for just general routine testing. I mean, testing the pH of the urine of pigs we've done before.
Yeah, so it'd be good
help.
to redo that depending on the stone result from Tim. Tim had a urinary blockage, so we're waiting on that result. And then that will determine if we need to change anything with the feed or anything else environmentally. And then probably do everybody's urine again. The pH we did, I remember, first thing in the morning.
Yes, when it's most concentrated. Yes.
I forget which way. Was it a bit high when we did them last? I try to remember.
Honestly, I can't remember either.
I just remember collecting it because it took forever.
Yeah. So yes, urine dipsticks, very exciting, great diagnostic tool. And I even remember a couple instances with goats and sheep in particular, like when Obama once was feeling a little bit under the weather, George maybe as well. And I remember our vets asking, do you guys have urine dipsticks so you guys can do a quick urinalysis of
So
that?
kind of be added to our, like, when somebody's not
Mental
feeling well,
checklist,
grab their internal temperature, like all the things, are they still appetent? So kind of creating that list and adding that in there. Part of those diagnostics.
Yeah, exactly. So basically, like, none of these things on their own will give us a definite diagnosis, like, oh, we did this dipstick, so this resident has this, but basically it just gives us more information.
And stuff we can gather and give to our vet on the way to the vet if there's an emergency situation, or just as we're building that case study as they age or as their disease progresses.
Exactly.
We can keep those checkpoints and see how they're doing.
Very exciting.
What's next?
Since we're talking about urine, we'll go on to the urine sediment
Look at
stain.
that.
So this is actually for doing a microscopic urinalysis. So the pH sticks, that's basically you just collect a urine sample, put it on the dipsticks, and it gives you results right away. With doing a microscopic urinalysis, so that would involve having your urine sample, putting it in a centrifuge to spin down so you get the right part of urine that you need, basically. And then you can put that on a slide, look at it under the microscope. The urine stain can actually help highlight like different features of it, so white or red blood cells, so things that might indicate infection, urine stones, things like that. Yeah, so that's very exciting.
You wouldn't know by that packaging.
Yeah, just
This is new to me too. I don't know a lot about this kind of stuff.
Yeah, so very exciting.
Wow. Who
Yeah.
would have thought?
I know.
Welcome everyone. If you're just tuning in, we are here live from the med room. Nicole is unboxing some diagnostic things that we've gotten recently thanks to your donations.
Yes, it's very exciting. Since we're on the topic of liquids, we'll move on to
Segue.
blood work. Yes. So these are actually like very beautifully colored. I don't know if you can see them. No, not really. That's okay.
Like a blue.
Yeah,
Ooh.
yeah.
They'll just say, oh.
Yeah, they're different. So these are actually
chlorhexidine.
Yeah. So these are actually stains for hematology stains in particular. So if you were to collect a blood sample, you can make a little blood smear out of it on the microscope. You dip it in these stains, which again, similar to the urine stain, will highlight different parts of it. So then you could look at that blood sample underneath the microscope to do basically a CBC, like a complete blood count. So there you're looking for like the presence and morphology of white and red blood cells. Is everything normal? Do you have an increase in certain white blood cells? Because the increase in certain white blood cells can indicate certain things. So Jeannie, for example, I think we mentioned a couple weeks ago, she was feeling a little bit under the weather. So we did a CBC and chem on her, but we brought it to the lab. So one of the things that they found on that CBC was that she was high in eosinophils. That's your word of the day. So that specific type of white blood cell. Also, I think it's the prettiest white blood cell.
Gotta get some pictures up next time.
Yeah, they're glorious. But the increase in that type of white blood cell can actually indicate, or it usually indicates, like a parasitic infection.
Which she had.
Yes.
That didn't diagnose her lungworm, but that pointed us in the direction that's what it could have been, and that's why we did the lungworm test.
Testing. Yes,
Ooh.
exactly. So her basically how she was presenting, so the cough, a little bit dumpy and appetent.
Yeah.
So we did our initial assessments, we did the lab work, and then that basically helped our vet decide, okay, I think it seems like it might be lungworm based on the presentation and based on the blood work. We took a sample for her. We did a fecal sample at the university's lab for lungworm. It's a very specific test that we do not do.
Yeah, we wouldn't be able to do that here.
No, it's like very, very specific and specialized. So yeah, she came back positive for lungworm. So she's been treated. She's doing much better. So yeah,
In the process of being treated. I think she's retested next week.
that seems right. Yeah. So yeah.
Wow.
Very exciting.
Nicole's box of goodies.
Yeah, it's quite excellent.
Thanks for tuning in, everyone.
Okay, this is like a 3-in-1. So the one thing that we're still waiting on is a centrifuge to spin down the blood and urine samples.
We have that.
Yes.
I can grab
So
that
we
one.
have a little guy. We have a little guy here that we use for
Starter
fecal testing. Yes. Basically, it has why we can't use it for blood work is just that it only fits a very specific type of tube, like very, very small. So we wouldn't be able to fit like a blood tube in there. So we use this for fecal testing. So we're waiting on our centrifuge that will be able to let us spin down fecals, but also urine and blood work.
Last piece of the puzzle.
Yes. So these three things combined basically let us do something called a PCV, or packed cell volume test, which is a very easy, very inexpensive, but pretty accurate way to assess for things like anemia, dehydration. I wish Too bad we don't have blood right now to just do it. It's going to be coming. If you guys want to see a PCV, it'll happen.
Episode. Yeah, we'll keep
So
you posted.
basically, you have your blood that has not clotted, so it has an anticoagulant in it. You suck it up into this tiny little glass tube.
So small.
Yeah, they're tiny. So those get spun down in the centrifuge, and then when it's done, so before you spin it down, this whole thing will basically it'll just be full of just plain, normal-looking red blood. Once you spin it down, it'll actually separate. It'll be in different layers. So the bottom will be red blood cells. So there will be a small amount of red blood cells, and then the rest will be the plasma. So that'll be kind of clear. So once you have that, actually, before you spin it down, you plug it with this very specific clay so the blood doesn't fly everywhere in the centrifuge. So that's number 2. Once it's done, you have this very cool reader that basically you put the microhematocrit tube here, and basically you line it up, and you line up where it changes from red blood cells to plasma. So then that'll give you your PCV value.
Cool. I did a video of that.
These are very fun to do, very satisfying, and like I said, a really good way, like a
You
quick...
only need a small amount of blood.
Correct. Yeah, you don't need a lot at all. Yeah, so you don't need a lot of blood. They're very quick to do. Just spin for a couple minutes in the centrifuge, then you have your sample. So that's a very good way of assessing things like anemia, dehydration. Nicole's on a medical roll today. Yes, I am.
Nicole is going off on all of her expert knowledge.
Yeah. So I'm very excited about this too.
That's awesome.
Yeah, like we're gonna.
And
be
what
able
would
to
be
do...
like? Why would we use that instead of like? Why would we do that test versus like some of the other ones you mentioned?
So this one, I mean, this would be able to diagnose or help diagnose like anemia, dehydration as well. So it's another just really, really great tool kind of in conjunction with everything else. Like doing a PCV, so this, and then a total protein, which if everyone at home remembers, that's what we use the refractometer for. These two combined are often done together just to kind of give you like a good little analysis into kind of what's going on, because blood and urine are amazing diagnostic tools because they're in the body, they're exposed to everything that's going on in the body, so those two things will have a lot of indication to what's going on, so it tells us a lot.
Yeah,
so,
if you're at home and you've ever gone to the doctor and they send you out for lab testing, those are usually two things that they collect for some diagnostics.
Yes, yeah. So the CBC, the total protein and the PCV, those are two like very important parts of the CBC, so complete blood count. So yeah, we're very excited.
I'm going to be getting really involved in this soon. We're gonna make sure there's lots of videos and photos to show you.
Yeah, and I guess this is not terribly new, but I can also just kind of show off like our little kind of blood collection.
Yeah, we whipped this out, what was it, a week and a half ago?
Yeah, doing some blood work on the goats and sheep. So needles, syringes, these are some different,
What's the difference between those two?
So the red one does not have any anticoagulant in here. So basically if you put blood in here, it'll clot and then you'll get the liquid plasma up top. And then the purple one has EDTA, which is an anticoagulant, so the blood won't clot, so it'll basically still be liquid. So it
depends on what you're testing on.
Yes. So the red one, you would use this like when we're doing like chemistries. So when we're sending blood to the lab to assess like organ function, like checking.
Like we did last week or the week before.
Yeah, exactly. For all the people
Jeannie, Diablo, Gilbert, Obama.
Yes.
Still waiting on those results.
Yes. So what you end up with this tube is what goes to those tests. And then this is used for like a CBC and a PCV. And then this is what's used for total protein.
And sometimes you do both.
Yes, exactly. So yeah, that's our exciting bin of goodness. Which, like, again, the fact that we can do all of this on site is extremely exciting. Like the fact that people believe in what we're doing and have donated towards this is just like it's incredible. Like if I had thought, like whenever I first started working here, that we would be doing this stuff one day. I mean, it was always a dream, but to like see it actually happening is it's just amazing.
We've come so far.
Yeah.
Even this space and how it's set up, and our little, like having a lab in here that's coming along, that we're going to have all set up perfectly one day. But just being able to
We're working on it.
Yeah, it's a work in progress.
Yeah.
We have a lot of opportunities here at the new property to kind of expand this a bit.
Yes.
But
we've
yeah,
really outgrown this space. Like
Yeah.
it's served us very well over the years.
it's a bit tight.
Yeah, there's a lot in here.
Yeah, but then we're able to grab and go. Like I'm looking at stuff in front of us, our gauze, our all that kind of stuff. We all know where it is, and we're able to do what we need to do in the moment for the residents, whether it's an emergency or just diagnostics,
Routine
like
stuff. Yeah,
Nicole
exactly.
mentioned. That's
Yeah.
part of our list, and we're doing that every second of the day.
Yes. Yes. Do we have time to do a quick little like, whoa, this is our meds room?
There's our meds
I've
room.
been yapping for a while, so
Nicole's gonna take a break.
Yeah.
So we have our lock box with controlled drugs behind Nicole. Whoops. We have a window, lots of light. There's a million things up there.
There. Yeah.
We have, I don't even know where to start with that stuff.
Yeah, it's kind of all over the place.
We have our pharmacy. Can I get it right?
Oh,
Oh, I did it.
there.
Yeah, look at
Wow.
that. On-site pharmacy. So we have all the medications that we need for the residents. If we need anything other than that, we're able to pick it up from our vet or a compounding pharmacy or whatever needs to happen. All of our syringes. You wouldn't think you need those many, but you do.
You do, yeah.
Syringes, needles, different sizes. What's over here?
General riffraff.
Boxes that we're still unpacking.
Yeah.
Gloves, a spot to put our used needles because we have that's biosecurity. Yeah, I thought of biosecurity.
Yeah, yes.
I don't know what it's called.
Yeah, I'm sure that seems right. Yes.
Where did you learn all of this, Nicole?
I went to school to be a vet tech, so I don't work in clinic anymore, but I am an RVT, a registered veterinary technician. So yes, I toiled away for several years.
So Nicole is the expert in all of these
I do my
things.
best.
Thank you so much for tuning in. And
Yes, thank you everyone for listening. I was like, I don't know, we'll just see how it goes. We think it's very cool.
yeah, it's very exciting. It's something that we get really passionate about and
Yeah.
excited about for the resident care, because that's what we're here for. We're here
Yes,
to make sure that
exactly.
their lives are so amazing.
Aw.
And with your help, we're
Yeah,
able to
truly.
make their lives amazing and pain-free, and so they don't have to worry about any of this stuff. They don't have to
Yeah.
worry about like what their next dose of whatever is or
Yeah.
blood work. They don't know that. They just
Yeah.
know that they're feeling great.
Exactly. We've got everything else covered.
So yeah, we do all that. It's a lot of
Yeah.
work, but
So that's why we're here.
thank you so much for tuning in. It's
Thank
been
you, everyone.
fantastic to hang out with you here today, and we will see you again next time.
Bye.
Bye.
Thank you, everyone.